We know having a first degree relative puts their risk 15 times higher than others. So that's important. And then if you have two relatives that have type 1, if you have your mother who has type 1, your father, or identical twin. So you took these high risk individuals and looked for triggers that either prevented them or protected them from going on to type 1. The other issue that you touched on is celiac and autoimmune thyroid disease, and that's Graves' and Hashimoto's. As I understand it, those folks have a much higher risk of developing type 1 diabetes, after developing one of those autoimmune conditions. And would you put them on the same level of risk as a first degree relative with type 1? And those individuals, my impression is they should be at the highest level of screening along with family members.
These people have some of the genes that would increase their risk. And so it is absolutely worth screening them and worth looking at. We know and we've seen over and over, not just in Teddy, but in other studies, that the earlier you catch it, the better the outcomes. And those improved outcomes last for years after diagnosis.